Look, we have seen COVID hit us like a bolt from the blue. An unknown enemy, very, very microscopic in size. We did not know which way the enemy was coming from. More so, it hit us almost after 100 years. And we did not have any clue to where it came from, how it came, and how it would affect a human body. Later, we came to know that it affects the respiratory system. And then we went on with our research, and slowly we came to learn from doctors and other staff who were involved in the management of COVID. As a doctor, we were initially very, being hit by an arrow, and that arrow we did not know where it came from. So initially we had a lot of problems tackling with the signs and symptoms of a patient. When we later realized that this disease primarily affects the respiratory system, we slowly zeroed in on our pulmonologist who could tackle the disease. As a doctor, when there were a lot of patients coming to me, as an orthopedic surgeon, there were a lot of patients coming to me asking for pain relief, and there was a guideline given that nobody should touch the patient and you should maintain distance from one person about say 2 feet or 3 feet. So that became the biggest challenge for us. As an orthopedic surgeon, if we have to treat pain, if we have to treat fracture, if we have to operate, you have to come near to the patient. Other than that, you will not be able to do so. So initially there was a lot of challenge on my staff, how to organize an operation theatre, how to organize clinics, so that obviously we could see patients with a little bit of precautions. So as a doctor, initially most of them were very, very apprehensive. Without coming in close contact with patient, treating patient is one of the most difficult things. Anyway, we evolved as days passed on. We evolved, and thankfully we circumvented all those areas, and we could give good medical care to all the patients. On second thought, as an administrator, convincing the medical staff, the doctors, and even other paramedics to handle patients in an unknown situation, in an unknown arena, became the most difficult thing, because convincing a human mind who is not otherwise convinced is otherwise also very difficult. So as an administrator, we had to put up isolated wards, isolated ICUs, and then ventilators, so that a patient in isolation could be given full tertiary level care at a secluded area in a hospital, and arranging that was a biggest challenge for us. Now, if you think of an ICU which needs to have gas pipelines, oxygen supply, you need to put up those lines and all, and it had to be put up within a very few days. So organizing workers to put up those lines, to set up an operation theatre, to order for ventilators, to order for huge supply of initially bloods and all. So that became a problem initially. But anyway, with the support and an understanding crowd around us, we slowly took care of things. But to tell you very honestly, as an administrator, it was difficult. But as a doctor, it was immense challenge, because I now realize what amount of convincing I had to do, because during the first lockdown period, I almost did around 30 to 35 surgeries personally on patients who were having fractures. And just imagine the situation as those days, when someone would die, his family members would not go in front of him because the guidelines were such. And in a situation like this, when I as a doctor, as a surgeon, had to operate on patient, I had to do a lot of convincing from my anesthetist to my OT staff to my sweepers. So it took us an immense hard task. Anyway, we could do it, and I am hopeful that given a situation with the learning experience now, things will be better if some things turn up in our next years of life. Look, during my days at Apollo Hospital, between 2001-2 to 2006, my 6 years of my life in Apollo Hospital, which happens to be very advanced tertiary level care in India, happens to be the first JCI accredited hospital in India. My experience there opened my eyes to a lot of things. And I always used to think, when I used to walk through the corridors of Indraprastha Apollo during those days as a registrar and then as a junior consultant, I used to always think and ask this question to myself: if this building can be done here, if this setup can be made up in a place like Delhi, why not in Silchar? But then at the back of my mind, I always thought there must be someone who, with ideas and money and bank, support, someone takes the responsibility, then we can develop a tertiary care center like that in our hometown. I came back to Silchar almost 6-7 years after that, and in 2011 what I did is I got a few friends of mine who were very, very cooperative, who actually took my idea forward, and I convinced them somehow that, look, Silchar is an upcoming city. Today it is tier 3, maybe it will be tier 2 in the coming days, and with a lot of other facilities around. We are surrounded by 4 different states. There are 4 different capitals which are smaller in terms of size and human resource. These 4 cities are, and Silchar needs to develop. So what I did is I opened up a company and then got a few friends of mine, went to the bank. I gave them an idea. They were initially very helpful, that okay, we will finance this project, and that's how I started it. And I then went to architect, a designer, a hospital planner, and then whatever my idea was, I actually spelled it out to them. So look, I need this, I need a ramp, I need a separate operation theatre, I need a 360-degree, a green building, I need a ICU which will have enough lights during the daytime. So I took those ideas to the architect, and I told him I need this thing. So he gave me an idea, he gave me a plan. So I sat on it, and it was a long drawn process. We had our negotiations with the bank, we had a negotiation with the architect, the developers, and in the meantime I had to do this thing, convincing of the doctors who were there. I'm thankful today that there are around 3 dozen investors who are mostly doctors. They have helped me with finances, and today here we are. We have a full-fledged neurosurgery unit. The best of the neurosurgeons are here with us. They are performing the neurosurgery. When I am off, I am also doing my spine surgeries, joint replacements, the medicine, the gynae ward, the surgery ward, the ENT ward, all the wards, the dental wards have already started, and I'm sure in the coming days Silchar will get what it deserves from JJIMS Institute of Medical Science. Look, we have a good team in managing JJIMS Institute of Medical Science. There are quite a few directors. I would not like to name them at this stage, but then all the directors are putting in their effort for the management of JJIMS Institute of Medical Science. We have an appointed CEO in the form of Mr. Prem Kiran Nath. We have a lot of other staffs who are doing day-to-day basic works as far as the hospital is concerned. We have a team of nurses, we have a team of paramedical staff, we have a team of front office executives, and there is also a dedicated team of so-called technicians who are doing good service. So day to day, as the footfall is increasing in the hospital, it is basically a dice which needs to work, fall in place from every quarters. The management, I don't look into the management on a day-to-day basis. For that, the directors are there. Few of the directors are now giving full-time attention to the project. And we have, as I have said, we have a CEO, we have an HR person, we have other people. The pharmacy is working almost 24 hours now. The front office is working 24 hours now. And we are, I think, doing a good job, fair amount of good job. We have around 85 to 90 employees at this stage. Almost 75 beds are functioning at this stage. We have at least 20 bedded ICU which is working, and we are going to improve in the coming days in the sense we are adding a number of beds, ICUs, and starting almost 6 operation theatres in the coming months. Look, Jeevanjyoti Institute of Medical Science, established in 2018, happens to be the only multi-speciality hospital in the entire Barak Valley, which is catering to almost 4 million people residing in Barak Valley, and another 2 million people who are in our vicinity, like the 4 states which covers us. If you look at the topography of Barak Valley, you will see that we are covered with hills on all sides. 270 degree, we are surrounded by hills on all sides. One side is the Khasi Jayantia Hills, where Shillong is the most important city. On one side we have Manipur Hills, where Imphal is the city. We have the Lusai Hills, where Aizawl is a city. And on one side we have Tripura, where Agartala is a city. So with Silchar, there is huge connectivity with these 4 cities of these 4 states. So what happens is that a lot of draining population are being benefited by healthcare workers and doctors of Barak Valley. So my idea when I started off thinking that I will create a multi-speciality setup, what people initially think is that they should come under one roof and get all the facilities. Like if I need a dental consultation, I go there. If the dental consultant refers me to an ENT specialist, then I should get the ENT specialist under the same roof. Now when the ENT specialist says, no, it is not my problem, and neurologist needs to see, so I should get the neurologist also under the same setup. So Jeevanjyoti Institute of Medical Science is such a hospital where you get all the super specialist doctors under one roof, which is not being offered by any other hospital in Barak Valley, which happens to be either 30 bedded or 50 bedded. Say, I'm not taking names and all, but most of the hospitals are either offering 2 or 3 departments. Like say maybe one hospital offers surgery and orthopedics, other hospital may be mother and child care and gynecology, other hospital may be offering only general surgery. So there are hospitals like this. So this is what the situation is. Jeevanjyoti Hospital is actually a multi-speciality hospital, all solutions provided under the same roof. One thing I forgot to mention is that we have a battery of tests that are done in our hospital. Our diagnostic wing is excellent. We have the best of machines which are available all across the country, from a 1.5 Tesla MR machine to a 128 slice CT machine where you can do cardiac angio also. We have all the best ultrasound machine. We have all the best blood tests that are done, from biochemistry to microbiology to pathology. All the tests are done, and these are at par with any of the medical institute and diagnostic center all across the country. So other hospitals in Silchar offer a limited service. Jeevanjyoti Hospital of Silchar offers manifold service under same roof. Look, one thing which needs to be understood is that we have an international border with Bangladesh. And a lot of patients in my private practice, I have seen a lot of patients with a proper visa and proper passport. They come here to Barak Valley, especially to Silchar, attend to the doctors, take their consultation. If surgeries are required, they will get the surgeries done and go back to their own country. Silchar has a huge potential for medical tourism. In my private practice also, I used to see a lot of patients coming from the neighboring Bangladesh, especially Sylhet district, and they used to come with all valid papers. They used to come to me prior to that, and if I would suggest that you need a spine surgery, they would ask me for how many days is the visa required. I used to recommend at least say maybe 20 days to anywhere between 20 to 40 days or 60 days, and they used to come with valid visa, get themselves operated and go back to their own country. I foresee in the coming days, Silchar will turn out to be a medical hub with so many doctors practicing here, and all qualified doctors, and all of them these days we are seeing the young generation of doctors. Competitively, they are doing their super specialization from the best institutes in the country, and I would take this opportunity to appeal to them that they come back to their motherland, to the place of birth, and give service to the people around and all. Like I have done about say 15 years back, came back from UK. This was a natural call, and I think if you can hear an answer to that call of yours, you can come back and obviously make Silchar a medical hub, a hub for medical tourism. Absolutely will benefit the economy, the socio-economic condition around this place.
Very interesting question you have asked. Look, JJIMS Institute of Medical Science, when I envisaged, I thought it should alone become a multi-speciality center, or rather a tertiary level care center for the entire Barak Valley. But as and when we progressed, and as and how we progressed for the last few years, I saw there is an immense potential that this valley actually needs a medical institution which is academic in nature. So obviously, if all the departments come up as desired in the coming days, a 300-bedded hospital, a multi-speciality center, a state-of-the-art operation theatre, a state-of-the-art diagnostic facilities, then we can think of going into the next step, which is establishment of a medical college. So I think the way forward for JJIMS Institute of Medical Science is that in the future we are going to see a medical college under the same roof. That's what I see for JJIMS Institute of Medical Science in India.